Hi, my name is ana.lagarto and I'm from Portugal and I have a background as a nurse and a midwife, and I always had quite a lot of interest in research, especially around fathers and their involvement in pregnancy in early years. So this presentation is about my master's dissertation entitled Fathers' Experiences of Antenatal Attachment. Okay, so why father's antenatal attachment? So we know that attachment is very important for the baby's survival and development because it's these behaviors between the baby and his main caregiver that establish this really important relationship that is very much about safety and feeling safe enough to explore and to grow and develop. So it's a very important relationship that will mark the child for the rest of their lives as well. So we know that in the UK there is an estimate 40% of children that unfortunately do not have this safe attachment. So it's still quite a big issue. So why are we looking at antenatal attachment? So we know that obviously, although the baby's not alive yet to have this behaviors with their caregiver, the parents themselves, they start imagining this child and they start imagining this relationship, and this can have quite a big impact what they're imagining with how they're going to attach the baby postnatally as well. So it could be a very good starting point for healthcare professionals to work with parents to develop this antenatal attachment. So why are we looking at fathers? We know obviously there's been some research around fathers and mothers and antenatal attachment, but not so much. And a lot of the research is based on how the mother's behaviors are towards the baby and then kind of trying to implement that and see how it works with the fathers, which doesn't always give very clear results. So we couldn't really find that much research that focuses on how fathers actually experience this process and how, could it be different from the mothers as well or other caregivers. And this is why we thought it was quite important to do this research, because we also know obviously fathers have a big impact in the outcomes for the mum and the baby. So we have to start looking at how we can improve this relationship for them as well, so they can have a better relationship after and help support their partners and babies as well. So to do this, our aim was to explore how fathers experience antenatal attachment, and to try as understand this, we had a set of objectives, which included to understand where does it start, this process, and how does it develop through pregnancy. Also to try to understand how fathers themselves viewed and described their own attachment to their child, and also to understand if they had identified any factors that had interfered in this relationship. So to try to answer our aim of understanding the father's experiences, we opted for qualitative design and used interpretative phenomenological analysis, or IPA. And this type of methodology focuses on how people experience big events in their lives, or what they perceive it's a big event in their life or a phenomenon. So we wanted to understand from the father's own experiences, and then interpretative part of it comes in trying to understand not just what is being said, but what is beyond what was said as well. To do this, because we're trying to look at one shared experience, which is fatherhood, we have to also use a relatively homogeneous sample, but obviously with some differences. So our sample criteria was to have fathers that were over 18 and that could speak and understand English as well. And we did not have teenage fathers or female partners, just because the experience would be quite different. And so this would not be able to be analyzed all in just one study. So we recruit through antenatal classes and antenatal midwife appointments, and we ask for the necessary ethical approval. So in terms of our samples, it's just some general characteristics. So the ages ranges between 29 and 40 years old. And our parents came from lots of different countries, and so 8 of them were white, European or British, but we also had 2 parents of other ethnicities as well. All of them were in the 3rd trimester, so after 28 weeks of gestation, but this was not by design, it just happened to be when parents wanted to do their interviews as well. So most of the pregnancies were planned, and most of the fathers also cohabitated, lived with their partners, and everybody had a higher level of education. So through our analysis, we came to 4 themes. So trigger moment, awareness of responsibility, transition to fatherhood, and emotional conflicts. So throughout most of our interviews, we found this trigger moment. So this moment that really marked the father's realization of, oh my God, this is going to happen. I'm going to have a child. I'm going to be a father. And also it highlighted how parents usually fathers were seeing the baby as a very abstract concept, and then as the pregnancy progresses, the baby becomes more and more real. So obviously there's quite a lot of factors, and different moments were mentioned by different fathers. So it can be pregnancy tests, scans, or feeling movements, or just going to classes and preparing for the baby. And this trigger moment, so this moment they really actually realize, oh my God, this is not really so abstract anymore, could be in different places for different fathers as well. So it's not always the same kind of moments that will trigger this moment. And we also had a few fathers in our interviews that didn't actually shown to have these moments or didn't describe them. And obviously there could be other reasons that we don't understand, but just to understand that it could be a progression that can happen really at different points of pregnancy as well. And usually when this started, what you could start seeing is that they had more engagement in this attachment behaviors and preparing for the baby and engaging with the baby as well. So as Callum explains, so he recalls that around 20 weeks he saw the scan, and it just, as he says, he just went from something that was there to something that just became more real to him. So it's just, again, this realization of understanding that this baby is going to come, and that quicker and quicker, he says, that the levels are coming, getting faster, and that is just a realization of, yes, this is becoming less abstract, it's actually going to be here soon. So after this trigger moment, something that started to become more of an issue for the fathers was this awareness of the responsibility of the role they're going to have and what they're supposed to do as well. So with this, it came 2 different things they felt responsible for. So one of them was their partners, and to be how could they advocate for their partners, especially during pregnancy and birth and just early days. How can they support them? But also came with this, quite interestingly, that although most of partners had financial stability and they had jobs, the fathers still quite felt they had to have this provider role. They had to have the financial means for the family. So then this created another issue for them, which is like, how can I do my job and sometimes have quite long hours, but at the same time be there for my child? So they wanted to be present, do bath time, story time. So they said this was actually something they used to think a lot during the day, so during work hours, to think, how am I going to manage this balance between the two? And the other thing, obviously, was the baby. So responsibility for the baby, and starting to prepare. So a lot of fathers said after they had this moment, they start to be very involved in what we call nesting. So prepare for the arrival of the baby, prepare the room. So the more physical side of things, and they really wanted to be involved in this process. The other thing they also wanted to do to be prepared was to have this kind of extra support of, also understanding what's going to happen and what is their role in the middle of this. So obviously they look for peer support and their own parent support, but also they look for classes and groups so they can have more knowledge. And this was really important for them, as we can see by Andrew's quote, that obviously he was feeling quite anxious about the whole process and not knowing what to do, and going to these classes really gave him confidence. And even when he told his partner how he was feeling and all the things he learned, this was also quite nice for the partner as well. So some fathers still mentioned they would like to have a little bit more support focused on them. So one of the other things that came through was about their transition to fatherhood and how they experienced this. So a lot of the fathers shared with me about how they envisioned themselves with the child, what kind of activities they would do, what they imagined for themselves. But also they did talk a little bit about their own experience and things they would like to repeat from their fathers and things they would not maybe like to do exactly the same way. And it just all kind of ties in as well with this big question about, am I going to be a good father, as Andrew said. And he also recognized that actually he had this big question, and he was a bit, they caused him a bit of anxiety, but actually he also recognized that probably everybody feels the same way, and it's just this self-reflection on yourself. But he also mentions the really high importance of his own father and grandfather as role models for what he needs to do. And most fathers as well as when they're starting to talk about this, so the more they planned in their minds about things they would like to do together and how the baby would fit in their normal activities that they already do, like going to the pub and so on. They also just express this really, big desire to meet the baby, see the baby, face to face finally, and be able to hold the baby as well. And a bit of as the high point of this whole road would be to have that moment with the baby. So emotional conflict really waves in through all the themes, but it was such an important thing that came out that we felt that it needed its own theme. So the emotional conflict starts right at the start of pregnancy, and we found that actually, even if the pregnancy was expected or not expected, the initial reaction, there's always a little bit of a conflict. So there's obviously happiness for expecting a child, but there's obviously quite a lot of anxiety as well about the future, what's going to happen, how this is going to change your whole life. So this was quite common, and parents can sometimes feel that they're supposed to feel they're always happy all the time, and this caused a guilty feeling of why I'm not just feeling super happy and nothing, and I feel other things as well. So obviously this was an issue that they mentioned could cause a lot of stress, especially if it was not an expected pregnancy and they were not accepting the pregnancy as well. This was even more of an issue for them. The other thing that came out of it was some fathers, obviously, that experienced previous pregnancy loss, they had a bit more challenging time to connect to the baby or allow themselves to connect to the baby, as we can see by Callum's quote. So he wants to be related, he wants to be attached, but however, he's kind of putting a stop to his own emotions and saying, no, I don't actually feel this attached, because if something happens, I need to be the support for my partner. So this was also seen with some fathers that had this different type of experience. So what we conclude from this study is that attachment does work as a process, and usually has this trigger moment to start the process or intensify it. Also that no single moment in this process would be more significant to all fathers, so it has different significance to different fathers. Also, we realize this trigger moment is more likely to happen in a clinical interaction or a peer interaction, so with other fathers-to-be or other recent fathers. And even though if the pregnancy is planned or was unplanned, every father had this moment of this mixed feelings during, especially at the beginning of pregnancy. And very important that fathers are really, really keen to be part of pregnancy and help their partner and their baby when they're born, and they want more support to be able to do this. So our study had quite a homogeneous sample, and it was done in a big city where most people had higher levels of education, and so it's quite important that we look at other parents in different situations and try to understand if they feel the same way or how they experience this event as well. What are the differences? But obviously this already starts to highlight to healthcare professionals how it's so important that we act in this stage of fathers' lives, and they're quite open to have more support, special education, mental health support as well, so they can deal with these feelings better and they transition better as well. But it's also quite important that obviously at the level of guidelines and guidance that usually healthcare professions get, that start to highlight more the importance as well of fathers in this in this situation, because this would also going to start to help to change the way healthcare professionals look at fathers and how they experience their involvement as well. Thank you so much for watching, and if you want any more information, any comments, you can send me an email. And I would just like to thank Dr. Maria Duazo for her support in my project, and also all the fathers that participated. Bye.